Cancer, as you probably know, is a complicated disease. As doctors learn more about it, they're discovering how it affects different groups of people. And that is true when it comes to minorities. According to the American Cancer Society, the death rate from cancer was 14% higher for African Americans than whites in 2015. That is down from a peak of 33% in 1993, but still troubling. A lot of that difference has to do with economics and how it affects lifestyles. Joining us now to talk about that is Dr. Thomas Herzog. He is the Deputy Director of the Cancer Institute at UC Medical Center. You are also a Professor of Gynecologic Oncology. We want to thank you for being here this evening.
Kristen, thank you for having me.
You guys have a conference coming up that will address the disparities in cancer care. What are the broad brush strokes for that?
So the UC Cancer Institute, under the direction of Dr. Bill Barrett, we're hosting the 5th annual retreat, and this year the focus of the retreat is making cancer care the great equalizer, overcoming health disparities in cancer. And the real hope there is that we start focusing on solutions, because up till now a lot of health disparity conferences have really done what you just did, display those very sobering data.
Yeah.
But we can do better than that, and we need to do better than that. So we're really focusing on solutions that we may have through science and through research. One of the great things is we're bringing in 3 PhDs from outside, such top institutions as MD Anderson, and who specialize in this area, and we're also engaging some of the PhDs who we have at UC who do a very good job in this area as well. And then one of the most exciting parts of the program is that we're going to break into small groups, and the small groups is a mix of the approximately 70 scientists and physicians who will be there who have an interest in this. And we're going to break into small groups and address some of these in a more granular way and generate what we hope are some solutions that actually can be put into programs that carry forth for the community.
To understand the problem a little better, you know, we hit one of the reasons there might be this disparity in cancer care, that being economic, but what are some of the other ones?
So there's a lot of them, and if you think about just nutrition, diet, physical activity, tobacco is a huge one, so tobacco exposure. And then if you look also at environmental exposures and viruses such as human papillomavirus, hepatitis B, but other environmental factors that we don't understand. Key though is a lack of early screening. So cancer really is dependent on, for best outcomes, to be screened at an early stage, and we see differences between certain subgroups in society than others, and that's a really big thing.
Would one solution be getting the word out about prevention testing?
It is. So I think that, you know, there's multiple solutions, but one of the things is community engagement and education, and part of that's culturally competent screening programs, so that we understand some of the barriers and build trust so that we're able to reach those who are currently not being reached in the community.
Well, so glad to hear that bright minds are tackling the issue. Dr. Herzog, thank you for joining us.
Thanks for having me, Kristen.
Really appreciate it.
Thank you.